All right, so today we are going to be diving into the world of anxiety disorders.
Okay.
And, we're going a little bit deeper than just those everyday worries that everybody has.
Right.
So whether you're prepping for a big presentation
Yeah.
or just trying to, navigate those daily stresses that everybody has,
Mm,
understanding anxiety can really help you take control.
absolutely.
So we're going to explore what anxiety disorders actually are. We're going to peek into the causes, and most importantly, we're going to unpack solutions
Yes.
and coping mechanisms
Love it.
that can make a real difference in your life.
It's so fascinating how anxiety is often really misunderstood.
Yeah.
We think of it as this purely negative thing,
Right.
but it's actually this fundamental human emotion that's wired into our survival instincts.
Interesting.
It's that alert system that helps us react to potential threats.
So it's like having this, like an internal bodyguard,
Yes.
but sometimes that bodyguard gets a little overzealous.
Exactly. That's where anxiety disorders come in. Instead of a helpful nudge, it's like a constant blaring alarm that just disrupts your daily life.
I like that analogy.
Think of it this way. Everyone experiences anxiety occasionally, like a small wave
Okay.
that you can easily ride.
Yeah.
But an anxiety disorder is like being caught in a massive rogue wave,
Right.
just throwing everything off balance.
Okay, that paints a pretty intense picture.
Yeah.
And there are different types of these rogue waves, right?
Yeah.
Like, is it always the same feeling?
You're right. Anxiety disorders aren't one size fits all.
Okay.
One type that was mentioned in your source material
Yeah.
is generalized anxiety disorder,
Okay.
where you're constantly worrying about these everyday things,
Mhm.
even when there's no logical reason to.
Yeah.
Imagine like constantly anticipating the worst case scenario in almost every situation,
Oh, gosh.
which can be incredibly draining.
Yeah.
Then there's panic disorder,
Oh.
characterized by sudden and intense panic attacks
Yeah.
that seemingly come out of nowhere. These attacks involve really intense physical symptoms,
Oh, wow.
like a racing heart, dizziness, shortness of breath,
Oh, man.
which can be terrifying to experience.
Just hearing that makes me feel a bit anxious.
Yeah.
So what about those fears that are tied to specific situations?
That's where social anxiety and specific phobias come in.
Okay.
With social anxiety, everyday social interactions become this source of intense fear.
Interesting.
It's more than just being shy.
Right.
It's this dread of being judged or humiliated
Yeah.
in social settings, leading people to just avoid them altogether.
Right.
And specific phobias are intense, irrational fears of particular objects or situations.
Right.
We're not just talking about a dislike of spiders. It's a debilitating fear that can trigger a panic attack at the mere sight of a spider.
Wow.
Yeah.
So we've got these different types of anxiety disorders, but what causes them in the first place?
Right.
Is it like flipping a switch, or is there more to it?
It's definitely not as simple as flipping a switch.
Oh.
It's more like a recipe with multiple ingredients.
Go on.
One key ingredient is genetics.
Genetics.
Family history can play a really significant role.
Yeah.
Research has shown that if a close relative has an anxiety disorder, you're more likely to develop one as well.
Wow.
It's like inheriting a predisposition, but it's not a guarantee.
So it's not destiny,
Right.
but a possibility.
Exactly.
What are some of the other ingredients in this anxiety recipe?
Trauma and stress are major contributors.
Okay.
Experiencing a traumatic event or dealing with chronic stress
Yeah.
can significantly increase your risk.
Got it.
Think of it like this. Your brain has a stress bucket,
Okay.
and every stressful event adds a drop to it.
Interesting.
Over time, if the bucket keeps filling without being emptied,
Right.
it will overflow.
Oh, yeah.
That overflow can manifest as anxiety,
Oh,
like your brain's way of saying, hey, I'm overwhelmed.
I see how that makes sense.
Yeah,
Are there other factors that contribute to this stress overload?
absolutely. Brain chemistry plays a role.
Brain chemistry.
Neurotransmitters like serotonin and dopamine
Oh,
are essentially chemical messengers in your brain
right.
that help regulate mood.
Okay.
Imbalances in these neurotransmitters can disrupt mood regulation, making you more susceptible to anxiety.
I see.
Think of them as the postal service of your brain.
Oh,
If the mail isn't being delivered properly,
right.
messages get mixed up and
Right.
things can go haywire.
So genetics, trauma, brain chemistry, it's a complex mix.
It is.
But I think what our listeners really want to know is, what can we do about it?
Right.
How do we deal with these rogue waves?
That's the crucial part.
Yeah,
Thankfully, anxiety disorders are highly treatable.
that's good.
And the great news is there are things you can do on your own
Oh.
in addition to professional help.
Yeah.
For example, Regular exercise
I
is
saw
a
that.
powerful tool.
Okay.
A study by the Anxiety and Depression Association of America found that just 10 minutes of brisk walking can significantly reduce anxiety levels.
Really?
It's like hitting the reset button for your brain.
So lacing up those sneakers is not just good for the body, it's a mood booster too.
Absolutely.
What about other lifestyle changes?
Sleep is crucial.
Really?
When you're sleep deprived,
Yeah.
your body goes into a state of stress,
Right.
making anxiety symptoms worse.
Okay.
Imagine trying to function on a low battery.
Yeah.
Everything feels harder.
For sure.
Getting enough sleep is like recharging that battery,
Right.
giving you the energy to cope with stress more effectively.
Okay, exercise, sleep.
I'm taking
Notes here.
Good.
Are there any other strategies that can help calm that blaring alarm in our brains?
This is where relaxation techniques come in.
Okay.
Deep breathing exercises are incredibly effective.
Deep breathing.
When you're anxious, your breathing becomes shallow and rapid.
Right.
Consciously taking slow, deep breaths sends a signal to your brain to calm down.
Interesting.
It's like hitting the pause button on the stress response.
That's a technique I could definitely use.
Yeah.
Anything else?
Mindfulness meditation is another powerful tool.
Mindfulness.
It's about focusing on the present moment without judgment.
Oh.
Instead of getting swept away by anxious thoughts about the future or dwelling on the past,
Yeah.
you learn to observe those thoughts without getting caught up in them. It's
Yeah.
like training your mind to become a calm observer
Yep.
rather than a reactive participant.
So we've got lifestyle changes, relaxation techniques.
Yeah,
What about professional help?
absolutely. Therapy is incredibly beneficial,
Therapy.
especially cognitive behavioral therapy or CBT.
CBT.
It helps you identify and challenge negative thought patterns
Okay.
that contribute to anxiety.
Right.
For example, if you constantly catastrophize,
Mm-hmm.
CBT teaches you to question those catastrophic thoughts
Oh, yeah.
and replace them with more balanced ones.
Interesting.
It's like reframing a distorted picture
Got
to
it.
see things more realistically.
That sounds like a powerful way to take control of your thinking.
Yeah.
And if therapy alone isn't enough.
Medication can be an option,
Okay.
but it's important to remember it's not a quick fix
Right.
and should always be discussed with a healthcare professional.
Of course.
Antidepressants, specifically SSRIs and SNRIs,
Right.
are commonly prescribed for anxiety disorders.
Mm-hmm.
They work by balancing those neurotransmitters we talked about earlier,
Okay.
helping to regulate mood and reduce anxiety symptoms.
It's like getting that brain postal service back on track.
Exactly.
But I think it's important to emphasize that no one has to go through anxiety alone.
Yeah.
We've talked about all these strategies,
hmm
but what about the power of simply talking to someone?
You're absolutely right. Social support is a vital piece of the puzzle.
Social support.
Talking to loved ones, friends, family members, anyone you trust
Yeah.
can provide a sense of relief and validation.
Okay.
Sharing your feelings and knowing you're not alone can make a huge difference. It's like having a support system
Yeah.
to help you weather those rogue waves.
And if you're struggling to cope, there's absolutely no shame in seeking professional help.
Absolutely.
Therapists and counselors are trained to help you develop personalized coping mechanisms
Right.
and work through those anxieties
Yeah.
in a safe and supportive environment.
It's a sign of strength, not weakness,
Right.
to reach out for help when you need it.
Okay, so we've explored a lot today.
We have.
Anxiety disorders are more than just everyday worries.
Right.
They can significantly impact your life.
Yeah,
But we've also learned that they're treatable,
for sure.
and there's so many things you can do to manage them,
Absolutely.
from lifestyle changes to professional help.
Mm-hmm.
As we wrap up, here's something for you to ponder.
Okay.
If you had to choose one lifestyle change
Okay.
or coping mechanism
Mm.
to focus on,
Yeah.
what would it be and why?
Good question.
Think about it, maybe even jot down your thoughts. We've taken a big step towards understanding anxiety today,
We have.
and I encourage you to continue exploring
Yes.
and learning about anxiety management.
Absolutely.
There are resources out there.
Right.
And remember, you're not alone in this.
You got this.
Thanks for diving deep with us.
Thank you.